Thank you very much. Let me share my screen. Good afternoon. Good afternoon, already? Afternoon. Good afternoon, everybody. Thank you very much for having me. I'll try to make this worth your while and talk a little bit about the advances in stroke treatment. Glendale Adventist or Adventist Health Glendale is a comprehensive stroke center, which means that it's a specialized hospital that is particularly geared to help patients with problems of blood vessels in the head or neck. Neurology has become very subspecialized in general. Before you would go to a neurologist for anything from a back pain to Parkinson's disease to stroke. Now, because of how complex it is, neurologists are very subspecialized. And I am, for example, not a general neurologist, but I am a neurologist who specifically treats stroke and the problems with the blood vessels that go to the brain and spine. I also operate on patients with stroke and brain aneurysms and such. So let me see how I can go further. Okay, so like I mentioned, it's a comprehensive stroke center, which is akin to a level 1 trauma center in trauma hospitals, which means that we take care of every the most complicated patients with brain bleeds and strokes and related problems. The Glendale Adventist, for those of you who don't know, was the first community-based certified stroke center in Los Angeles, and since 2015 it has been a comprehensive stroke center and has received numerous accolades every year from the American Heart Association and Joint Commission. We are known for many things like, fastest door to CT time in Los Angeles County for 2 years in a row. We have a complete neurointerventional team that consists of a neurologist and a neurosurgeon, but although the more proper way to name us in terms of what we do is brain plumbers, because that's exactly what we do, which is sort of a crossbreed between neurology, neurosurgery, and radiology. And we call ourselves neurointerventionalists. We partner with EMS every year, and May is an exciting month for all of us because it usually is the stroke month, and we invite the paramedics and thank them and provide a lot of teaching to them and learn from them about how we can better take care of the community when it comes to a devastating disease such as stroke. Many of you probably know this, but they say that repetition is the mother of success. So recognizing the common signs of stroke revolves around the following abbreviation, BFAST. The key word behind this BFAST is sudden, because it usually is, stroke comes on suddenly. Sudden trouble with balance, probably the most under-recognized cause of stroke. Strokes in the back of the brain cause problems with balance and not typical symptoms of the stroke. It particularly pertains to sudden dizziness and loss of balance that feels as if you are drunk or you're walking on a rocking boat, as opposed to when the room spins around you. Because the most commonly people come to the emergency room with dizziness and they describe vertigo, room spinning around you. That kind of dizziness usually comes from inner ear. The dizziness like an earthquake, like the loss of balance, that you can't walk and you have to spread your feet apart in order to be able to maintain balance, that's the dangerous kind of dizziness, and that usually indicates that this could be a sign of stroke. Eyes is another under-recognized symptom. What happens in stroke is that there is a loss of vision to one side or the other side of both eyes. That sometimes is perceived by patients like a vision loss to one eye, but in reality, it's just a visual field on both sides that is lost. That indicates that the problem is not with the eyes, but with the part of the brain that controls the vision to the eyes. The acronym FAST has been in use for the long time. You probably all know it. It's the sudden droopiness of one side of the face, sudden arm weakness, sudden trouble speaking, and leg gets involved too frequently, but because arm gets involved much more frequently than leg, and in order to make the acronym sound cool, they didn't put the L there. Although if you put L, it would be Belfast, which is the city in Northern Ireland, would probably be even better. But anyway, speech, and then T, obviously behind every success story, there is the speed. We have very short time window, much like firefighters. If you call the firefighter at the time your house is burned already, whether I extinguish the fire or I don't extinguish the fire makes no difference whatsoever because the house is already burned. Same thing with stroke. It needs to be done immediately. The patient needs to call 911 immediately. And the sooner you come to the hospital, the faster the workup is done, the triage is done, the faster the treatment can be administered, and the more chances of success, obviously. So really quickly, what do we call a stroke? There are two principal kinds of stroke. It's either a blockage of a vessel or a rupture of the vessel. The blockage of the vessel is what traditionally is called stroke, and it's called ischemic stroke because it comes from lack of blood supply to a certain area of the brain. A ruptured vessel is called a hemorrhagic stroke or brain hemorrhage. Technically speaking, it's also a stroke, just the treatments are different. There are multiple other terminologies to stroke. The most unfortunate one is called CVA. It's not really a good term because there is nothing accidental about stroke, but we call it brain attack sometimes. But all of these terms, even the reason aneurysm is there is because an aneurysm can rupture in the brain and it can cause a bleeding in the brain. And that's why ruptured aneurysms cause a particular kind of stroke. So you can hear all these terms used interchangeably. They all mean stroke. Why is it important to be fast in stroke? It's because there's a huge number of brain cells that die every minute. The brain is deprived of a blood supply. The numbers are really staggering, and that's why disability is very significant after a stroke if the stroke is not recognized and not treated in time. There is what's called a mini stroke. Many times the patient come, and this term is very overused because anything transient many times is labeled by doctor as a TIA or a mini stroke. That doesn't necessarily mean you did have a stroke, but you can have a transient symptoms. All those symptoms that were described previously in the acronym BFAST can be transient and can come and go. And it is sort of a, indicator that the stroke is forthcoming many times. That's why it's important to have a thorough evaluation if you have transient symptoms and not delay the evaluation for such. That when I say it's frequently over-recognized is that, somebody says, you know what, my pinky tingles, and that is not a TIA, no matter who says what. This is not how they manifest. My arm suddenly went completely numb and weak, and I couldn't hold a cup of coffee for 5 minutes, and then it came back. That is a TIA. So there is a distinction, and obviously the more serious symptoms deserve a prompt and thorough investigation. What we call ischemic stroke, like I said, if there is a blood clot in a vessel and there is a certain area, brain is a very oxygen sensitive organ. So in here you can see an area that is stroking out. This is a CAT scan of the brain, and if the blood flow is not restored in a timely fashion, there will be irreversible change, and these will progress to a full-blown stroke. The brain cells, like I said, die when the blood flow stops to the brain. That area of dead cells is called an infarct, much like in the heart when it's called an infarct. And very similar to heart attack, we call this brain attack because the underlying mechanism is very similar. So we have been recognized by American Stroke Association, like I said, for 14 years in a row for being among the fastest in the country for delivering stroke treatments. There are two kinds of stroke treatments that we'll talk about in the subsequent slides. The first treatment is thrombolytic. It's a clot-busting medicine that's given by vein. For many, many years, there was only one kind of medication called alteplase or Activase or TPA. That medicine has been in use since the mid-1990s. We were actually the first hospital in the country that participated in a clinical trial of the medication that we use now. Instead of TPA, it is called TNKase, which is sort of like a cousin of Activase, but it works better and it is able to open more clots and improve patients' outcomes better. And it is administered over 5 seconds as opposed to TPA that's been administered for over an hour. So much easier on the nurses and much easier on the patient in terms of regulations of the drip and everything. So our hospital now is providing tenecteplase. The medication, regardless of which one it is only administered within the first 4.5 hours because it doesn't work later on because the damage becomes irreversible. That is why it is very, very important to act quickly in case there are symptoms suspicious for stroke. In the past years, you may have heard it here and there, we use a variety of devices. That's why they call us plumbers, is we navigate these devices from a blood vessel in the arm or a blood vessel in the leg to a blood vessel in the brain under the X-ray, and we remove the clot. This pertains to big clots because big clots are not easily dissolved by the medications, and you need literally to either suck the clot out or remove it with one of these devices. We have a variety of different tools. The time window for this kind of treatment, by the way, is not certain because everybody is different. So we have more room to play with. There could be a person who comes within 4 or 5 hours and we do imaging studies and the damage is already done. Think of it as there are 2 fires in 2 areas. In one, there is a very strong wind and the wind blows towards the direction of the fire and the fire destroys the property very, very quickly. So by the time the firefighter comes, there's nothing to save anymore. In another area, there's no wind whatsoever. So by the time the firefighter arrives, they can rescue a lot of it. So that's the same way with people. People are wired differently. So there are people on whom we will intervene up to 24 hours after the beginning of symptoms. And there are people who will have nothing to intervene on after 4 or 5 hours. That's why we do fancy imaging to determine who's a candidate for this kind of treatment and who isn't. It's not universal. The bleeding kind of stroke is when the blood vessel bursts in the brain and causes bleeding. There are various types of bleeding. The most significant one that we can really help with is rupture of a brain aneurysm, which is a bubble-like outpouching on the vessel. These strokes are less common, but they are more likely to be fatal, whereas the ischemic strokes are more likely to cause disability. There are a variety of devices that we can use to treat the aneurysms. We used to put, as you see on the left, a bunch of platinum wires in the aneurysm called coils. Now we have devices that shunt the blood away from the aneurysms. They look like the picture in the center and the picture on the right, and they are safer, and the treatments are improving and getting better faster than our phones get upgraded. So we are really excited, and it's a very rapidly developing field of medicine. So it's very, very exciting to be able to provide care for patients. So a little bit about risk factors for stroke. Again, many of you are probably familiar with them. There are what's called modifiable and non-modifiable risk factors for stroke. There is nothing we can do about the fact that we're getting older, not without a miracle. There is nothing those of us who are men can do about being a man because, again, not without a miracle, but because men are at higher risk of stroke. There is family history, you can't change that. The majority of risk factors for stroke are, however, controllable, and they are very modifiable and very addressable. The #1 risk factor for stroke worldwide is high blood pressure. And I can't emphasize strongly enough how important that is and how much this gets neglected. That's not to say it's difficult to control the blood pressure. I know many times patients come and they say, you know what, I check my blood pressure religiously, but it jumps up and down all the time. And, you know, it's hard for doctors, but the more you record your blood pressure, the more information you provide to your primary doctors about what your blood pressure is doing throughout the day, the easier it will be for them to put you on the right medications. Cigarette smoking, I have this conversation all the time with the patients here. I don't know what else needs to be done to discourage people from smoking. It's banned everywhere. If it were up to me, I would just ban selling cigarettes altogether, or I would tax them so much that would prevent people. I would make one pack of cigarettes cost $1,000, and I don't care if somebody complains about it or not, because this is universally stupid habit, in my opinion. But you know, it's unfortunately is still a problem, although much less of a problem nowadays. But you know, very, very major risk factor. When we puncture the groin or an arm of a person and we image the vessels, I can tell just by the picture of the vessels who's a chronic smoker and who isn't. And believe me, it's not a pretty picture. Your body looks like an ashtray from the inside, from the side that you do not see. And you know, nobody wants to look like that. Diabetes, very strong risk factor for stroke. Unfortunately, diabetes, especially type 2 diabetes, chews up the vessels, and you know, it's very, very important to adhere to the recommendations of the doctors and keep the blood sugars under control. All of them in above can cause blockages in the carotid arteries in the neck, from which the pieces of plaque can travel to the brain and cause stroke. Heart disease, in particular atrial fibrillation or irregular heartbeats, are a major, major risk factor for stroke. And it's very important to be on certain blood thinners, because not every blood thinner works for atrial fibrillation. And it is also a very important and controllable risk factor for stroke. In terms of prevention, you know, steps you can take to prevent the stroke. We already talked about blood pressure. Very, very important. A good range in general, it may be individual for some people, but is between systolic pressure of 100 to 140, but it's close to 120 over 80 as possible. You don't need to panic if the blood pressure is elevated once, but if it's consistently elevated throughout the week, you should certainly notify it, usually primary doctors or cardiologists or kidney doctors that administer blood pressure medications, so that it can be adjusted and be maintained in a proper range. Atrial fibrillation that I mentioned, basically it's what it is irregular heartbeat. You can see here on the bottom EKG what a normal heart rate looks like compared to atrial fibrillation. Because the heart contracts irregularly and randomly, the blood flow slows down and blood clots form in the heart, and then the number one recipient of the blood, heart just FedExes the clot to the brain, basically. And that's how people with atrial fibrillation get strokes. There is a variety. It used to be only Coumadin, was very difficult to control. I don't know if you know or not, Coumadin is a rat poison. That's how it was discovered initially. They would spray the grass and make the cows eat the grass, and the cows would bleed from their udders. And this is how they discovered that Coumadin actually is a blood thinner, and it works very well, but it's difficult to manage because you can't eat certain things. You need to control, go get the blood checks. Nowadays, we have a number of new medications that are just as good, if not better, than Coumadin, and they have less bleeding risk, and you can eat whatever you want with them, and much safer profile in general. I already said everything I should about cigarettes. I don't want to keep talking more about that. Obviously, if you drink alcohol, I have nothing against a glass of wine, but use moderation because heavy alcohol drinking very much is related to stroke and to liver cirrhosis, which in turn can cause the bleeding kind of stroke as well. Regular exercise, which fortunately California is ahead of many other states, and we have fortunately loosened restrictions right now, so people can go and exercise, and even the gyms are opening. So very, very important to exercise. The recommendation is to exercise at least 30 minutes, at least 3 times a week, and maintaining a healthy weight and a healthy diet is also very, very important. The dietary restrictions or recommendations could be individual, and I would tailor that to your concomitant diagnosis and whatever your doctor recommends to eat. But in general, Mediterranean diet is a very healthy diet that has been shown to prevent stroke and heart diseases and such. And obviously, I can't say this strongly enough. After the brutal year or year and a half that we've been through, hopefully it's coming to an end. It's very important to relax because all of our stress levels have been probably very, very high with everything that's been going on. So it's very important to remember to take some time to relax. We have, success stories from our strokes, and to us, any patient that walks home out of the hospital with a stroke, because what we don't want to have, like ischemic strokes frequently disable people, and that disability is absolutely devastating for the patient and the family. So for us, any patient that walks home is a huge success story. So this patient was, and these are published stories, so I don't hijack patient information and presenting to you. This was published, so patients gave consent to sharing this. It can affect young people. This woman is a physical therapist, and she woke up on Cinco de Mayo and was found by her son. She was mute. She couldn't move the right side. Totally healthy. Never had any problems before this. She was 41 actually when she had a stroke, and we've been following her for 2 years, and we pulled the blood clot out of her brain, and she is doing great, and she's back to working as a physical therapist. Another example, this patient is 33. He actually has atrial fibrillation, and he was on a blood thinner, and despite that, he had a blood clot anyway. And he came to us mute, and he wasn't moving the right side, and he recovered very well. And we were very fortunate to be able to provide care to him and help him out. Another young gentleman with actually a extra tissue, sort of a benign tumor in the heart. He thrown clots to the brain twice within 30 hours. So we had to go and fish the clot out twice on 2 consecutive days. Kudos to our nurses. Now is a nursing week. So if there is anybody in the audience who's a former nurse, I want to congratulate you, because if it were up to me, every day would be a nurse's day. And with the exception, we'll give us doctors one day, every other day can be nurse's day. This is how much nurses do to the hospitals, and really important to acknowledge their work. Anyway, this gentleman also did great, was discharged from the hospital independent in care. Thank you very much. If there are any questions, I'll be happy to answer them. And I guess I have to look in the chat window to see if there are any questions. Thank you. Thank you for listening.
Doctor, so we're just going to take a second to stop the video before we do the questions.
Sure.
What is the best blood thinner for atrial fibrillation?